I'm excited to tell you that my guest today is licensed naturopathic physician, doctor of traditional Chinese medicine, licensed acupuncturist, and she works with the Center for Natural Healing. Welcome, Dr. Diana Joy Ostroff.
Hi, Donna.
Hi, Dr. Ostroff.
Hi,
I'll
call
just
me
say that.
Diana.
It'll be Diana. Okay, we'll do that. If I go to see my doctor, it is because it's my annual checkup or there's something wrong.
Right.
When are people coming to see you?
That is such a great question. People come to see me when there are many things wrong. So because I don't spot treat, I don't just have someone come when they have a headache, or they may come when they have a headache, but typically someone that has a headache, they're going to try the pain pills, or they're going to have already seen their doctor. But usually when people have started to have a lot of things wrong with them. So things start to snowball. You know, they have the fatigue and the low energy, and they get headaches or migraines or monthly problems, or, you know, problems with reproduction, or problems with bloating, or things that just might go untreated. Maybe something like fibromyalgia or chronic fatigue syndrome, where medical doctors say, well, you just get used to it and live with it. Or aging, you know, people that are aging and they're not aging gracefully and they want to be aging gracefully, they would come to me. People that have pain that's not going away when they really want the pain to go away, and they don't just want pain management, which is actually pills. Mm-hmm. So I can help them get rid of the pain. So with my diagnostics and my treatment, you know, naturopath, I'm a full-fledged physical medicine doctor, so I can do acupressure, acupuncture, spinal alignment, joint mobilization, myofascial release, balance the cranium, balance the musculoskeletal so that the pain goes away. We also have pain laser therapies. We have detoxification therapies for people who have been on substances or on lots of medications that want to clear their system. We have, so basically people that want to get healthy. It's not just about having a problem, a particular problem. It's about not feeling and living the life they want to live in their highest capacity, because I believe that we can not exactly reverse the aging, but we can slow it down, and we can have a greater sense of wellness and feeling youthful and feeling alive and energetic without every year accumulating a little more fatigue or a little more weight or a little more achiness. Why should we, if there's way not to? So the people that come to me typically don't want to age. They want to feel good. They want to continue their life activities. They don't want to dry up. They don't want to have brittle bones. They don't want to be told that they're going to get osteoporosis and need a hip replacement. So I work with people of all ages. You know, people that just don't want to go the conventional way. They just want to believe in their healing abilities to stay young and vital.
So where do you begin with a patient?
Comprehensive interview, a diagnostic workup, a consultation. I have different kinds of diagnostic equipment in my office to find out how the cells are working. I use tongue and pulse diagnosis to be able to assess what's going on with the strength of the organs. I can see so much from the way a person stands, the posture, their skin tone, their complexion, what their eyes look like, their expression, you know, their fingernails. So when I was in school, we were taught that if we can see someone that's 200 feet in front of us walking down the sidewalk, we should be able to know on some level what that person is experiencing just by the way they carry themselves. And so, you know, do we need all kinds of fancy diagnostics? Yes, sometimes we sure do, but there's so much that can be done just by inspection, just by seeing a person, talking to a person, learning what's going on with them, and figuring out what needs to be addressed. What needs to be addressed typically in people? The basics are their insides, their digestion, their ability to absorb nutrients. So it's great to take a vitamin. What if your body is not able to absorb the nutrients? Then we have to be able to assimilate the nutrients. We have to be able to utilize those nutrients, and we have to be able to eliminate the toxins or whatever doesn't need to be there. Otherwise we accumulate, whether it's in fat, whether it's in lipoma or cysts or tumors or, you know, other things, plaque or things that clog up the system. So if there's, you know, it's about cellular health. So every cell needs to do two functions properly. absorb nutrients and eliminate waste. So we need to be focused on those two responsibilities for all the cells, of which there's about 70 trillion cells in the body. And they all have those two functions. So if we can just work on those aspects of it, and with every cell, including the nervous system cells. My specialty is naturopathic medicine. I was originally not planning on being a doctor, but I had health problems. And I was convinced that health and medication were not a fit. Like, I didn't understand how medication could create health. So I was looking to figure out how to create health within myself without medication. And I was introduced to naturopathic medicine school in 1982. And that was all over. It was all over. That was exactly what I wanted to do. And I pursued higher education for 16 years. I went 10 years to alternative medical schools, naturopathic, Chinese medicine, acupuncture, and studied all around the world with top doctors in the field of alternative medicine, biological research, and quantum medicine to learn what really heals the body. And that's what I teach my patients now. The kind of work that I do is to heal the cells within the body, to heal the cell physiology, to heal the organs, to strengthen and repair any dysfunction, any imbalance that's going on with whether it's hormonal, whether it's digestive or immune system related, whether it has to do with nervous system function or reproductive energy. But rather than just to think is create, yes, that's part of it. I'm talking more about actually restoration and finding the cause of the problem and addressing it. Because I'm of the firm opinion that we don't catch a cold, we make a cold. So our body is going to either create health within its system or create disease. And when it gets to a point of saturation where it can't take any more toxin in, then it's going to have to release and eliminate. And that's a cold, and that's a discharge, and that's okay, because that is the way the body gets rid of what it doesn't need. So I just have a different way of thinking about things, and I look at nature as the way that everything happens. It's through nature, and that's why, according to my theories and understandings of what I've learned, is that rather than to alter the chemistry of the body or to treat a symptom with an agent, let's support the healing properties within the function of the person's physiology to help bring about healing from within. So we're not just treating a symptom, we're addressing the cause and treating the person.
Awesome.
So that's more of a holistic mindset.
Good. I'm glad you're here.
Thank you.
Thank you, and we will see you next week on Center Stage, Wednesday at 2 o'clock.